The exploratory analysis conducted by Seymour and colleagues of the GALLIUM study specifically looked at patients who progressed within 24 months of studying therapy on study. What they have found is that patients who were enrolled on obinutuzumab chemotherapy arm actually had lower risk of developing early progressive disease compared to patients who were enrolled on rituximab chemotherapy arm. That hazard ratio was about 0.46, so there was a risk reduction from 17% to roughly 10%, which is quite significant for this patient population. So this is a very tantalizing result, which raises a hypothesis that the combination of obinutuzumab with chemotherapy may somehow lower the risk of early disease progression. That certainly remains an unmet medical need in therapy of follicular lymphoma, and this is very exciting data.
So the GALLIUM study did an exploratory analysis to see whether the use of obinutuzumab with chemo will decrease the risk of patients with early disease progression. So what they found is that there were many fewer early disease events in patients who received obinutuzumab chemo compared to rituximab chemo. There was about 20%, 19 to 20% of patients with the rituximab chemo-containing group that had early progression, which is very compatible with what we saw in other studies. However, with the obinutuzumab treatment, there was only about a 12% risk of early progression. So it definitely did reduce the risk of early disease events, and it also reduced the risk of death by about 34% or so, 34%. So that was very compelling. I think that whether or not that's going to influence the use of obinutuzumab over rituximab remains to be seen, but it definitely was what the data showed, is that there were a decreased number of disease-related events, but why that happened, we don't really know. The interpretation of this is that obinutuzumab seems to somehow affect the natural history of follicular lymphoma, but again, we don't really know why these patients had a decreased number of disease-related events. So I think that remains to be seen.
While it is difficult to consider this data practice changing right now, it is certainly hypothesis-generating data which suggests that maybe patients who are suspect to be early progressors should receive a combination of obinutuzumab and chemotherapy. The problem, of course, is that we never necessarily know who those patients are. As we discussed earlier, there are some predictive factors which potentially could identify those patients for us. However, those factors do not work with certainty. Therefore, applying this data in everyday clinical practice may be somewhat difficult. I would say that patients who present with features which have been associated with high risk of early progressive disease, including those that I've mentioned before, such as high FLIPI score, advanced stage, high LDH, high beta-2 microglobulin, I would strongly consider use of a combination of obinutuzumab and chemotherapy for those patients over rituximab.
I don't think at the current time it impacts my personal decision to treat patients with follicular lymphoma, because obinutuzumab containing chemotherapy and rituximab containing chemotherapy the side effect profile is different. If you have someone that's a little older and whom you are thinking about using bendamustine, obinutuzumab may not be your first choice, because that group of patients were more likely to experience toxicity. So I think that the decrease in disease-related events alone would not suffice, in my opinion, to choose one over the other, at least now. That is something that's currently being investigated.